Let's get it straight. Diabetes doesn't respect a city boundary. Depression doesn't know that you live in East Palo Alto or Redwood City. And mothers live in all corners of the Mid-Peninsula, and many rely upon Ravenswood for services that are literally life-saving. I was asked to comment upon what the health center means to the community. It's really quite simple. It means dignity.
The community that Ravenswood Family Health Center serves is primarily East Palo Alto, and it's considered a federally designated medically underserved area. So for many of our patients, it's an access issue. We are the closest provider for them, so we're accessible from a location perspective, from a financial perspective, and also because 85% of our staff speak a second language, either Spanish or Tongan, which are our two largest patient population groups.
Un niño muy contento, ¿eh? Sí. Ya no tiene problemas con eso, no tiene vomitando.
No, está bien.
All our patients have a primary care provider. If they need to be seen today, we see them today. The healthcare team involves not only their provider, we now have patient navigators. The navigator has a broad range of activities that they might do for a patient, particularly for immigrant populations, to help them understand our healthcare system. You know, how do you get a specialty appointment? Where do I go for my pharmacy? How do I get the kind of services that I need for my family?
Some newer clients are coming into transitional drug treatment programs. We bring them into healthcare to get them started back on, getting their bodies together, feeling better. I make all of their appointments, their physical exams, lab appointments, and follow-up appointments, just to navigate them through the system. Today he had questions about employment. He wants to get a job, he wants to get back on the right track, so I referred him to Job Train.
We have a huge problem with obesity with our patients and diabetes. All of our navigators have been trained to do diabetes education. They can do home visiting as well. They go into homes, look in people's refrigerators, and can actually provide advice.
Check your temperature, okay?
The goal is that the patient's a member of the team and that they are involved in their self-management. Because prevention isn't about what we do for our patients, it's really about activating patients and getting them involved in their own care.
In your next appointment, appointment?
Okay.
September. So if you feel any pain anywhere, make sure you write it down before you go see the doctor so that the doctor can talk to you.
I'm healthy right now.
Yeah, good.
Yeah.
So
It's a real focus on wellness instead of a focus on illness. How well you keep your patients, not how sick your patients are and how many things you do to them.
Okay.
And if we can get to that point in this country, we can really reduce the cost of healthcare and actually have better outcomes for people's health.
¿Está bien?